Right, Jan. So I know we just talked about prenatal labs, and that's something you're wanting to do. Another thing that we talk about in this appointment is genetic testing. Is that something you've heard of before? Is that something you've done research on or know anything about? You've done some research on it? Okay, great. So genetic testing is a way we can screen or test your baby to see if they have any genetic conditions or genetic abnormalities. So things that it can test for are trisomy 13, 18, and 21. You've probably heard of trisomy 21, that's Down syndrome. 13 and 18 are Edwards and Patau syndrome. And so basically what genetic screening does is it can test to see what your baby is at risk for. With screening, it's not going to tell you, yes, your baby 100% has a trisomy. It's going to tell you they are at risk for one. But whereas a diagnostic test, which is a more invasive test, will tell you the information, yes, your baby will most likely have this condition, or no, they will not. And so there are different ways to screen for genetic testing. And based off of your history that we went through, your medical history, your family history, your psychosocial history, you don't have any significant history that contributes to a risk factor of your baby being at risk for a trisomy. And so that's another reason why genetic screening could be a great option for you if it's something that you're wanting to do. Some people also like to have genetic screening done because some people think it's helpful for them to know if their baby is at risk for having one of these things happen, so they can better prepare, plan, and educate themselves when their baby is born. And the likelihood of them making it to full term as well. Whereas some people, they decide not to do genetic testing for the complete opposite of that reason, because they don't think it would be helpful for them to know that information prenatally, because it might stress them out more. Genetic testing is not something that's required. It's something that is completely up to you. My job here is just to give you all the information on it so you can have these tools in your toolbox. You can go home after this and do more research with genetic testing if you're wanting to, but it is something that is an option and available to you. There's different types of genetic screening. The most common genetic screening is the non-invasive prenatal test. And so this is something that I could do for you today, since you are at least 10 weeks pregnant right now. And so this would just be a blood draw on your arm. And the reason why I also bring it up today is since we're doing your prenatal lab work, I can just do one poke in your arm and get all the blood we need today. And so this test tests for the trisomy 13, 18, 21, can even test for gender. And so these are all helpful things to know. And so with this testing also, it works off of a sliding scale. And so this Natera rep card I have here, he's really great if you call him. All the clients I've talked to who have done this testing have had really great success with how much they've had to pay for this test, because I know it can be around $800 out of pocket. And so the rep can help get you a really great price. I've had people basically pay close to nothing, so it's something that people favor for sure. Another option is sequential screening that is done in the second trimester. So you would at least have to wait until you're out of your first trimester. It's a 2-part test, so it's also a blood draw. And it's something that you would also need an ultrasound for. And so ultrasound is an extra cost. You can do the ultrasonographer here, who is in-house, cash pay only, or you can go to the hospital to have an OB do your ultrasound. I know hospitals take insurance, and so you would just have to see what the price would be with them. But this again would be a blood draw, and then the ultrasound is to just making sure everything looks good. This sequential screening also looks for Down syndrome, trisomy 18, neural tube defects, and heart defects as well. And the ultrasound's done between 10 to 14 weeks to confirm and date your pregnancy. And an anatomy scan is another ultrasound that you can have between 18 to 22 weeks. It's most accurate between 20 to 22. It tests for aneuploidy and congenital anomalies, Down syndrome, heart defects, and also checks on your placenta as well. Again, all of these things are screenings. Things can be missed. There can be false positive rates with all of these, but they are all options. And so that is something that you can do if you are wanting that. Okay, so Jan, hello, you came back. And a week later, we got your test results in, and your results are positive for an increased, your baby having an increased risk of having a trisomy. So I know this might feel really scary. This is not the news you were hoping for, especially since we talked about how your baby was at low risk. So I want you to know that, again, there is a chance of a false positive rate. And I also want you to know that this does not 100% guarantee that your baby has a trisomy. Something that you have the option to do, that could be your next step, is getting a diagnostic test done. So a diagnostic test will tell you that your baby will most likely have a trisomy, or no, they will not. There's two different ones. There's an amniocentesis, and so with the amniocentesis, you have to be at least 15 weeks. It is an invasive procedure. It is something that is done by an OBGYN. It's a needle that gets inserted through your belly and through your uterus to collect amniotic fluid. There is a 1 out of 200 to 1 out of 400 chance of someone miscarrying. And then there is chorionic villus sampling. This is done between 10 to 13 weeks. And so this is also done by an OBGYN, and it's a very similar procedure. They're just taking a piece of placental tissue to test for the birth defect or disorder as well. And so there's a 1 out of 100 to 1 out of 200 chance of miscarrying. The amniocentesis is a 98% chance of it being guaranteed, whereas the CVS sample is a little bit lower than that. So those are your options and things that you can do moving forward. They're not required, you don't have to do them, but in the meantime we can continue to prepare and educate what things would look like if your baby did have a trisomy. And so you have the option to choose what you'd like moving forward.